Hello, my name is Tony, and I am a volunteer for the National Health Service Birmingham and Solihull Clinical Commissioning Group. I myself have diabetes, and I sit on the body to do with diabetes related issues, in particular type 2. Now, there have been some interesting developments recently whereby we know how do you find out first and foremost if you are at risk. Chances are some of you have been to your GP surgery and asked for a blood test, which is the most effective method to find out whether you have the condition diabetes. However, alongside the issue of the blood test, which is still being done at your GP surgery, it has been decided that we need to branch out, especially in these worrying times, of people trying to find out what risk they are at getting diabetes and then leading on to prevention. So, Diabetes UK have developed a Diabetes UK risk tool called Know Your Risk. And that can be done by visiting the Diabetes UK risk tool website of riskscore.diabetes.org.uk. And it will ask you to put in your weight and your height and your ethnicity and your age and your gender. And once you put in all these factors, it will determine, based on calculating it all, whether you are no risk, low risk, medium risk, or high risk. And we within the National Health Service Clinical Commissioning Group, Birmingham and Solihull, are trying to reach as many people as possible who actually might be in the high to medium risk and need to do something to improve their situation so they don't end up getting diabetes. Because there is what is known as the National Diabetes Prevention Program done throughout the entire country for people to go to sessions and get help and advice over a given period to reduce the risk that they are possibly showing. So, in particular, people from the African, Caribbean, and Asian community, sometimes referred to as BAME, Black and Minority Ethnic Groups, are 2 to 4 times more likely to develop type 2 diabetes than white people, and at an earlier age too. So within the white community, the average age tends to be around about 40. In the black community, because of the DNA or the genetics, it happens 15 years earlier at age 25. So here's a chance for everybody to decide, let's go get ourselves checked. The Know Your Risk Health Check tool can help to determine, as I said before, whether you are no risk, low risk, medium risk, or high risk. So do visit it and put in all the things that it asks you to do and determine whether or not you need to take action to prevent diabetes from coming your way. It's called a self-referral. And that's not to exclude the ones done by the doctors or the GP's clinic, but this is another feature that has been brought in fairly recently for us to decide, do we need to check where we are in terms of this medical condition? I urge people to get their risks checked on the Know Your Risk tool. Thank you very much.